We are
Gastrointestinal Physiology
and Urodynamic Science.
We diagnose patients who have problems with their bladder and with their bowel.
We perform endoanal ultrasound scans, which involves popping a small probe into the bottom and looking at the structure of the muscles in the back passage. We also perform anorectal manometry, which is a pressure test looking at the strength of the muscles in the back passage. We also perform urodynamics routinely on a lot of our patients to look at how the bladder is behaving and look at whether the bladder is squeezing inappropriately and how the bladder empties. The most rewarding part about the job is when you finish the test and you've got a diagnosis for the patient, and that means that they can then be treated.
A lot of our patients come with conditions that are really debilitating, and so to see those patients and to help them in some way is really important to me. So I love the interaction with the patients. You often get to hear a background story from them as well, and you get chatting about all kinds of things, so that really makes my day. Often patients will come to see the clinical scientist for the diagnostic tests, and then we will get the results, and then we can work really closely with the consultants to help formulate a management plan for those patients.
Working in a multidisciplinary team means that we're able to ask questions and we're all able to get the best out of each other, using each other's expertise to make sure that we are getting the best outcome possible for the patient. So typically, to become a clinical scientist in gastrointestinal physiology or urodynamic science, you will need a degree of some kind in a scientific area. You will then need to apply for the scientist training programme,
which is a 3-year programme where you perform the job alongside studying a part-time master's degree. And at the end of that, then you will have some exams, and if you pass, then you're a qualified clinical scientist.
I would recommend undertaking some work experience in urodynamic science or in gastrointestinal physiology, as these are separate professions when you're training, but ultimately a lot of people work across both professions.
As a clinical scientist, we are not scientists in a laboratory environment, which is often what it gets mistaken for. So that was one thing that I think I didn't realise, maybe going into the scientist training programme, was the patient contact is daily.
In terms of skills, it's important that you're able to communicate with patients, so you need to have good communication skills and you need to be compassionate towards patients.
We are Physiological Sciences.